one government residential land or plot to an applicant wishing to have one in approved maps. The ministry explained that the terms stated below govern the granting of government residential lands to applicants who meet the conditions. The conditions are as follows. If the applicant is a man, he should have attained the age of 23 years and should be the supporter of a family constituting a wife and children or either of the two, or has to be the supporter of one parent. If the man is supporting only himself, he should be aged 40 years. The title deed will be issued in the name of two spouses if the man is a family supporter. If the applicant is a woman, she should have attained the age of 23 years and should be the sole supporter of her family or married to a non-Omani and a permanent resident in the Sultanate, or divorced or widowed or deserted and has no children, or is a self-supporter provided she is aged not less than 40 years. Priority in granting government residential land is given to a family that does not possess a house or residential land suitable for building. It is not permissible to sell granted lands except after the completion of construction in accordance with the terms and conditions set in a decision to be issued by the Ministry of Housing and Urban Planning. For granting government residential land to a family, the condition is that no member of the family has been granted a government residential land as per the provisions of the Royal Decree on granting government residential lands. A government residential land is granted to an applicant in his respective vilayat or in the vilayat where the applicant has his or her permanent premises of work depending on circumstances. It is possible to exempt some applications for some of the above-mentioned terms and conditions on granting government residential lands in accordance with rules to be set under a decision issued by the Ministry of Housing and Urban Planning and after the approval of the Council of Ministers. Applications registered previously will not be cancelled. They will be dealt with as per the terms and conditions stated in Royal Decree No. 42 by 2021. Those applicants will be distributed in accordance with a set of criteria including precedence of application, the number of family members, and whether the family possesses a residence or an existing land plot suitable for building. In case the wife applies in one governorate and the husband applies in another governorate, the two applications will be merged in one application with the date of the earlier application. In this case, the land will be granted in the governorate to which the husband belongs or has his permanent premises of work. If the applicant possesses a built residential land plot, his or her application will not be cancelled, but the applicant will not be given priority among entitled people. It is not permissible to sell the granted land plot except after the completion of its construction. As per the law, it is permissible to grant a woman a residential plot if she is aged 23 and is the supporter of a family. If a woman is not the supporter of a family, she can be granted a land plot only after she attains the age of 40. In condition that a spouse is granted a land plot, the application of the other spouse is deemed null since the purpose is to provide the family with a residential land. Ownership of a commercial land plot or a commercial building has nothing to do with granting residential land. In the case of a woman married to a non-Omani, it is a condition to grant her a government residential land from the state provided she is a permanent resident of the Sultanate with her residency evidenced through standard methods of authentication. Those are the local stories for today. We'll take a short commercial break and we'll be back with Fighting COVID. Welcome to Fighting COVID. While some countries are still struggling to get their COVID-19 vaccines, the situation in other countries is quite different. The states, for example, have turned down hundreds of thousands of COVID-19 vaccines. Several states are turning away COVID vaccine doses from their federal government allocations as the daily average of coronavirus vaccine doses administered across the United States has fallen below 2 million for the very first time since early March. Experts say the state's smaller requests reflect a steep drop in vaccine demand in the United States. Wisconsin officials have just asked for 8% of the 162,680 doses the federal government had set aside for the state. In Iowa, officials asked for just 29% of the state's allocated doses. And in Illinois, the state is planning to request just 9% of its allocated doses for everywhere except for Chicago. North Carolina, South Carolina, Washington State and Connecticut are also scaling back on their vaccine requests. As demand falls and the spread of the virus slows in the United States, the Biden administration is under increasing pressure to share the vaccination with countries like India, which has been ravaged by a catastrophic surge. About 83% of shots have been administered in high and upper middle income countries, while only 0.3% of doses have been given in low income countries. Dr. Amesh A. Adalja, an infectious disease physician at the Johns Hopkins Center for Health Security, said that a shift in US demand was expected. After people who were most eager to be vaccinated had shots, he said the rollout of vaccines was going to be a much more challenging prospect. There remain people who are hesitant to take the vaccine or may have other reasons for not doing so. So that has led to a drop in demand, Dr. Adalja said. Nationwide, since a mid-April peak of some 3.38 million doses administered each day, daily average doses have fallen by about 41%. In turn, that has left states ordering fewer doses than they had at first. But some places like New York City, Maryland and Colorado are still asking for the full amount. To increase demand once more, officials need to make it as convenient as possible, Dr. Adalja said, including expanding the availability of walk-in clinics and even door-to-door vaccinations. The Johnson & Johnson vaccine is notably convenient since it's only one dose and can be stored at normal refrigeration temperatures for at least 3 months, making its distribution considerably easier. But allocations of that have remained low nationally after a pause over extremely rare cases of blood clots was lifted last month, and that has contributed to the drop in vaccinations being given more broadly. Once you pause the vaccine, it was going to be very hard to unpause it, Dr. Adalja said. President Biden confronted lagging vaccinations has shifted the administration's strategy to battle the pandemic. Changes include creating a federal stockpile of vaccine doses to be given to states as needed instead of strictly by population, and investing millions in community outreach to target underserved communities, younger Americans, and those hesitant to get shots. Mass vaccination sites will wind down in favor of smaller settings. Pharmacies will allow families to walk in for shots, and pop-up and mobile clinics will distribute vaccines, especially in rural areas. Federal officials also plan to enlist the help of family doctors and other emissaries who are trusted voices in their communities. Dr. Adalja suggested that federal health guidance should take care to avoid underselling the vaccine as the nation tries to get more people vaccinated. Guidance on issues such as traveling and mask wearing can be loosened aggressively for vaccinated people, Dr. Adalja said. They seem to be several steps behind what infectious disease doctors like myself are telling people that are fully vaccinated and what they can do. Experts warn that states where vaccinations are falling behind, particularly in the South, could be especially prone to outbreaks in the weeks ahead as more contagious virus variants have spread. Texas and North Carolina are trailing the national average in vaccinations, with about 40% of people receiving at least one shot. In Alabama, Mississippi and Louisiana, about a third of residents have gotten their first shot. Talking about contagious variants, there are new concerns as Indian COVID variant clusters have been found in different parts of England. Britain has labelled the Indian variant of coronavirus as a variant of concern following a rise in the number of cases in the UK and evidence of community transmission. Public Health England designated variant B.1.617.2 one of the 3 variants identified in India that has spread to Britain a variant of concern. But it has also said there was insufficient evidence to suggest if the variant is also more dangerous. Cases of the B.1.617.2 variant increased to 520 from 202 over the last week, PHE said, mainly in London and the northwest town of Bolton, with almost half the cases related to contact with a traveller. The public health body said other characteristics of the B.1.617.2 variant are still being investigated. There is currently insufficient evidence to indicate that any of the variants recently detected in India cause more severe disease or render the vaccine currently deployed any less effective, PHE said in a statement. The original India variant, officially known as B.1.617, was first detected in October. Last month, PHE had categorized 2 further subtypes, B.1.617.2 and B.1.617.3. Other variants of concern include variants first identified in Kent, Southeast England, as well as South Africa and Brazil. Meanwhile, the situation in India is still grim. With the rising cases, especially with the new variant, India has now turned to ex-army medics as COVID surge called for a lockdown. India is to recruit hundreds of former army medics to support its overwhelmed healthcare system, the Defence Ministry said on Sunday. as the country grapples with the record number of COVID-19 infections and deaths amid angry calls for a complete nationwide lockdown. Some 400 medical officers are expected to serve on contract for a maximum of 11 months, the ministry said in a press release, adding that other defense doctors had also been roped in for online consultations. COVID-19 cases and deaths have been hitting records every 2 or 3 days. Deaths rose by more than 4,000 for a second consecutive day on Sunday. Many Indian states have imposed strict lockdowns over the past month, while others have announced restrictions on public movement and shut down cinemas, restaurants, pubs and shopping malls. But pressure is mounting on Prime Minister Narendra Modi to announce a nationwide lockdown as it did during the first wave last year. The Indian Medical Association called for a complete, well-planned, pre-announced lockdown instead of a sporadic night curfew and restrictions imposed by states for a few days at a time. But unfortunately, it's not just infections that India has to worry about. Tens of millions have plunged into poverty because of COVID-19. India has a large population of migrant workers who form part of India's vast unreported informal sector, which accounts for half of its $2.9 trillion domestic demand-driven economy. A protracted COVID wave is shrinking incomes and wiping out savings of people, posing the risk of a double whammy for Asia's third largest economy that's still struggling to recover from last year's pandemic-induced recession. The government estimates India's gross domestic product shrank 8% in the year ended March, its biggest contraction since 1952. Many economists are cutting their forecast for the current fiscal year as rising unemployment and dwindling savings dim the chances of a double-digit growth. Chief economist for Asia Pacific and S&P Global Ratings slashed his prediction to 9.8% from 11% earlier. Fitch Solutions sees the economy expanding by 9.5%, a projection that's below the Bloomberg consensus of around 11%. On that note, we'll take a short commercial break and we'll be back with more COVID updates. Welcome back to Fighting COVID. So in some other COVID-19 news, several employees of a pharmaceutical company have been arrested in Indonesia for allegedly washing and reselling used COVID nasal swab test kits. Up to 9,000 passengers at an airport in Medan have been tested with reused swab sticks, says police. State-owned company Kimia Pharma is now reportedly facing a potential lawsuit launched on behalf of the travelers. COVID nasal swab testing has become routine in many countries hit by the global pandemic. Police said that they believe the scam had been happening since last December at Kuala Namu Airport in Medan, North Sumatra. Passengers are required to have a negative test if they want to fly, and the airport offers the option of getting the swab done on site. Airport authorities had used antigen rapid test kits supplied by Kimia Pharma. Following complaints from passengers that they had received false positive test results, police sent an undercover officer to pose as a passenger. When he was swabbed and received a positive test result, other officers swooped in and raided the test site where they found a used test kit that had been recycled. 5 Kimia Pharma employees, including the company's Medan manager, were arrested. The suspects are accused of breaking health and consumer laws by washing nasal swab sticks and repackaging them for sale. Local media said authorities have compiled reports from 23 witnesses and are investigating whether the profit from the scam, estimated to be around 1.8 billion rupiah, was used to fund the construction of a lavish house for one of the suspects. Kimia Pharma, which is headquartered in the capital Jakarta, has since fired the staff involved and promised to tighten internal controls. Recently, 2 lawyers who frequently flew via Kuala Namu airports in recent months said they were planning to sue Kimia Pharma. In a collective lawsuit, they hope to get 1 billion rupiah for each passenger who had been affected by the scheme. Earlier this week, Indonesian authorities said they had identified 2 cases of the new COVID-19 variant seen in India. Last month, Jakarta stopped issuing visas for foreigners who had been in India in the previous 14 days. The Muslim-majority nation has also banned domestic travel at the end of Ramadan this month, a period which traditionally sees people traveling across the country to visit relatives, and introduced heightened restrictions for other dates. Indonesia has seen one of the worst COVID-19 outbreaks in Asia and overall has recorded about 1.7 million positive cases and 46,000 deaths due to the pandemic. Those are the latest updates about the coronavirus situation across the globe. We'll be back with midday update tomorrow, so stay tuned and keep watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.